Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
Fletcher is a 29-year-old male referred for court-ordered counseling. He has a long history of repeated offenses including driving under the influence, domestic violence, battery, and other violent acts that fortunately have not yet caused any serious injury or death to the victims. An interview with his wife reveals that for the last few years, he has lied about almost everything. He's able to get hired for jobs because he is very engaging and likable, and then invariably he gets fired because he misses work and doesn't do his job properly when he is there. According to the wife, they have known each other since high school, where Fletcher was very happy and well-adjusted. He was on the soccer team, he was liked by teachers, and never demonstrated the tendencies that he does now. Apparently, in college, he got involved with a fraternity that was notorious for alcohol and drug abuse, and he started drinking heavily. It was all, quote, all downhill from there, end quote, according to his wife. The psychiatric mental health nurse practitioner considers that. Do you consider that A, history and symptoms are most consistent with antisocial personality disorder? B, Fletcher needs a neurological workup to include an EEG and assessment for neurological soft signs? C, consistent with his symptoms, Fletcher will likely respond well to a stress interview? Or D, it is likely that substance abuse is the underlying cause of symptoms and should be explored further. In this circumstance, given this history, clearly D is the correct answer. It is likely that substance abuse is the underlying cause of symptoms and should be explored further. Remember, none of this started until he got involved in the fraternity that was notorious for alcohol and substance use. Typical antisocial personality disorder history typically extends into adolescence, and that's not the case for Fletcher. Fletcher's behavior appears to have changed following his substance abuse behaviors, much more consistent with a diagnosis of substance abuse disorder. And when that's the case, a diagnosis of antisocial personality disorder is not warranted. No, the lying may be consistent with antisocial personality disorder, but that's just one feature. And remember, personality disorders have diagnostic criteria just like any other mental health diagnoses. And a big one is that the patient with antisocial personality disorder, the behaviors do not appear to be substance-related. Again, antisocial personality disorder, usually, almost always, the behaviors can be traced back into adolescence, even if the diagnosis wasn't made at that time. Similarly, abnormal EEG and neurological soft signs. And remember, by neurological soft signs, we're talking about things like, clumsiness, the inability to process multiple stimuli, that sort of thing. They're not always readily apparent unless you look for them. They are more common in antisocial personality disorder, among other things, but they're not as typical of substance use disorder. A stress interview is a technique in which the patient is confronted aggressively with the inconsistencies in his own history. And again, it's a therapeutic technique in antisocial personality disorder. With a stress interview, the interviewer is purposefully trying to stress the interviewee. And that's definitely not something that's going to be appropriate in Fletcher's case. In Fletcher's case, what is very telling is that these behaviors began to occur after the alcohol and drug abuse occurred in college, and that you don't see any of those histories before that in the high school years. So in that circumstance, it makes D the best answer here. Antisocial personality disorder and associated neurologic workup with EEG and assessment for soft signs. They just would all have been apparent. Antisocial personality disorder would have been apparent much earlier and is not typically related to a substance use disorder phenomenon.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.